it's me. Hi. Hope you guys got a good lunch because we're going to be talking about diet for a minute here. So my name is Mousumi, and I'm one of the work group leaders of the Nutrition and Exercise Workgroup. We're going to be talking just basically. I don't think I need to stand this close to the mic. You guys can hear me, right? Okay, cool. Awesome. So, my goal up here is to just give you an overview of the really cool conversations that we've had over the last year or so regarding nutrition and exercise within the context of Refsum disease. A lot of really great insights and inputs, and Diane has been super helpful in like sort of summarizing and helping to put together these slides. So thank you very much for doing that. So I'm just here to just give you that summary, and then hopefully that will open up the doors for some great discussion. I've heard, and I'm sorry I wasn't here this morning. I was talking earlier to a big group, but I heard it was a really, really engaging discussion. So I'm looking forward to contributing to that. So let's talk a little bit about what we've discussed over the last year or so regarding nutrition and exercise. And I think the bottom line, and this is, this idea of metabolic control, I think it's cross-cutting across multiple work groups here, right? But, really the sort of conclusion that we came down to is that what are the different factors that predict metabolic control? And, when I'm speaking about metabolic control, I'm talking about in the context of how does this affect Phytanic acid levels and how does that affect symptoms, right? So we know that obviously that diet plays a role. It's part of the therapy, and we have some understanding of that, but we don't have a comprehensive understanding of that. There's still a lot of things that we don't fully understand. I think the Global Dairy Foundation has done a really good job in getting more concrete guidance with the guidelines, and I know that Anne has been involved in a lot of the food testing. And I know that we've got these clinical guidelines that are coming up. Really, really excited about all of this. We know some stuff about diet, but we don't know all the things about diet. And the way that it predicts Phytanic acid levels. What we seem to know less about regarding metabolic control within the context of Phytanic acid levels control is what is the effect of exercise. That's something that's I'm really interested in, is really understanding the role of exercise. Right now, I think there's no standardized guidance regarding exercise. I think some of the experts in the field and the expert physicians, as well as other clinicians, are giving some guidance, which is great. But there is definitely a need for more evidence-based guidance regarding exercise. Related to that, what is the role of weight loss? We know that it probably has some effect, but the degree of that impact, we don't really know. Other metabolic triggers such as illness, fasting, surgery, all of these things we know probably play a role, but we don't know to the extent of which this happens. So, and then another one, and this is where I feel like a lot of this is sort of cross-cutting a lot of work across a lot of work groups, is understanding the role of the different genetic variants and how that plays a role in the metabolic control and subsequently these Phytanic acid levels. So what have we talked about over the last year? So we have, come very clearly to the conclusion that, despite diet management, there's still a lot of variability in Phytanic acid levels and overall metabolic control. So we know we're pretty certain that, diet alone does not determine these outcomes related to metabolic control. There are multiple interacting factors. We do feel that metabolic control, in relation to these Phytanic acid levels, is a modifiable determinant. Genes play some part, but there's so many of these other things that likely play a role, and it's really important to understand the interactions of all of these different factors if we're going to be talking about achieving outcomes for future therapeutic development. So these are the things that we have, sort of digging into, some of the stuff that I brought up earlier. We know that diet's important. We're still recommending, obviously, that, individuals with adult refsum control, restrict their Phytanic acid levels. We know that exercise probably is important, but I think the overarching thing that we're getting from the community is that they're just they're concerned about exercise. They don't necessarily know what exercise does, and it's something that, you know, they sort of go forward with caution. So there needs to be more evidence in that. There is this variability, you know, despite similar dietary adherence, again, sort of really playing to this fact that there's all these different factors. And, you know, metabolic stressors, such as illness, fasting, surgery, weight loss, you know, other sort of life events could potentially have an impact on phytanic acid levels. But I think the big takeaway with all of these things that we do know is that this is, you know, there's still a lot to be known regarding these factors. This is all very descriptive. We don't have any clear-cut sort of understanding of relationships between these factors and metabolic control and phytanic acid levels. So related to that, you know, what are, you know, some of the big knowledge gaps that we are looking at here is, you know, why are these differences despite adherence in phytanic acid levels? What are the different things? We think we have an idea, but, you know, we still need to really establish those relationships, especially with respect to surgery, you know, any sort of like medicines, fasting, other types of stress, exercise. You know, what are the things that we can modify? Can exercise affect metabolic control? What are the best ways to exercise so that we influence metabolic control in a way that doesn't elevate phytanic acid levels? And what are the things that and how do we track this? What are the things that we can measure that's going to predict symptoms and other outcomes? So bottom line, you know, as I've been saying from the beginning, what are the things that determine metabolic control in adult Refsum disease? So I believe these are these from the registry or the community survey? Okay. Sort of summarizing what individuals with adult Refsum disease want to know regarding metabolic control have to do with exercise. Can I exercise safely? I've alluded to this before. You know, why are my levels still high despite dietary adherence? You know, what is the role of aging on phytanic acid levels? And, you know, that we know, you know, that metabolism changes as we grow older. So, and we don't really know how that affects on metabolic control relative to phytanic acid levels. What happens when I'm sick? If I'm trying to lose weight, how do I do that safely in a way that's not going to cause big spikes in my phytanic acid levels? So, you know, coming directly from the community, you know, in this effort to be community-based, patient-based in terms of moving research forward, these are the types of questions that really should be driving our research agenda. And these should be prioritized, in my opinion. I mean, this is something, I'm biased, you know, so we recognize that I'm biased here, but I feel like these should be prioritized as important questions. This is not just a question of, you know, making lifestyle choices. This is, you know, this will literally affect our, you know, patients' health if, you know, in terms of the choices we make. So we need to have very clear, or at least more clearer answers on, you know, how to navigate this. So let's talk a little bit about, you know, we have these understandings, we have an idea of what's probably happening, but we don't really have that, you know, that evidence. And so what are some of the things that are potentially precluding us from getting that clear evidence? And, you know, this is probably going to be, I'm assuming this is probably going to be a repetition of some of the priorities that were discussed this morning, is that, you know, we need more longitudinal data. But here in this particular situation, we need more longitudinal data about nutrition, right? About, you know, what people are eating, what people, not just what people are eating, but also, you know, how they engage in metabolic, exercise and physical activity, and also, you know, keeping track of all these potential catabolic stressors. Are they having surgery? You know, have they just engaged in a lot of weight loss, you know, over a period of time? We know, obviously, that there are issues with biomarkers. Yes, we have phytanic acid levels, but are there biomarkers beyond phytanic acid levels that could be more robust? metabolomics may play a role in this. And then, and so the data gaps, the biomarker gaps, they can be, cross-cutting across all these different work groups that were in terms of like the needs. In terms of infrastructure related to nutrition and exercise, we need more people with nutrition and diet and physical activity expertise to come in and help guide like what our roadmaps are, and using this evidence that we hope to collect to develop evidence-based guidance, and coordinating that information with all of the other data that we're collecting, that we hope to be collecting with the building out that infrastructure of longitudinal data collection. So these foundations are absolutely necessary for nutrition, exercise, metabolic control, understanding all of these things, and it's going to be challenging without these. So this is what we need to do first in order to get to this point where we have the clinical trials, the interventions to be able to really answer some of these questions that the community wants answered. So overall, the recommendations, I'm letting this sort of segue into the kind of roadmap that we're proposing for the Nutrition and Exercise Work Group is, starting with building that foundation, developing that data infrastructure, getting that longitudinal data collection that is relevant to understanding the role of all of these factors that I mentioned before, diet, exercise, catabolic stressors on this metabolic control, and doing this longitudinally, identification of biomarkers that are relevant to this topic. And then using that to try to design these studies, having that infrastructure and trying to understand what are not just understanding what are the drivers of metabolic control, but what is the quantitative impact that each of these factors have, and what are the different factors that put individuals with Refsum disease in different states of risk, right? And then using that information to provide evidence-based guidance, evidence-based management, and ultimately hopefully develop better therapies, whether it be pharmacological or that are more diet and exercise based. So kind of finishing up here, this is this potential roadmap that we've laid out throughout discussions, and and it's kind of repeating what I just said in the last slide, but just talking a little bit more specifically in if we're looking at like say a five-year strategic plan, right? Maybe 7. I think that goes up to 7. In the first couple of years, really trying to build out that data infrastructure, trying to figure out what it is that we want to measure regarding dietary intake, regarding exercise, regarding any sort of life event, looking at and following this longitudinally, so then we can really actually track what is the role of age and other factors on metabolic control, looking at taking account of surgeries, illness, fasting, weight loss, and also what are relating that back to what are the different gene variants. So a lot of cross-cutting stuff. So this is all natural history, right? But we need to be very clear and intentional about what are the things that we're going to be measuring, and make sure that these outcomes are relevant and important in answering the questions that the community wants answered. So building out that data infrastructure, right, so that we can properly characterize what metabolic control looks like and what are the factors that are involved. And then once we have that infrastructure built, then that's what's going to allow us to study what are the relationships with the correlations between illness-related increases, or what fasting does, or what having that data set will allow us to really design these studies so that we can observe what happens over time, what happens in relative to these different factors, so that we can have a proper characterization of the role that each of these factors play on metabolic control in adult Refsum disease. And then using that information, once we've made these observations, again, this is not rocket science, we all know this, but using those observations to then develop well-designed intervention studies, clinical trials, to be able to look at, well, does this type of exercise increase, decrease, allow you to get your health-related outcomes and also maintain phytanic acid levels? So, just moving from those observational studies into those intervention studies so that we develop these interventions that are based on that evidence, and then we can have, more clear evidence-based guidance for adult refsum disease within the context of nutrition, exercise, and overall metabolic control. So I think, so this is the timeline. Again, just sort of summarizing what I've said. Like I said, my job here is simply to give you guys some things to talk about as we discuss. With respect to building out that infrastructure, really, I think this is where we really need to, these types of meetings are really important because it allows us to communicate with the other work groups and really figure out where are these shared needs and, where can we, how can we prioritize by figuring out what are the things that all of us want to, that as work groups want to prioritize. And I'm guessing that, there's going to be a lot of overlap there, right? So we can start there. So I think I'm finishing up here. So what we are looking for here is, better endpoints so that we end up with better outcomes, looking for, so that we, again, in the interest of having these interventions, these clinical trials that will give us a much clearer understanding than where we are now about how metabolic, understanding the factors that control metabolic control will be important in the improvement of patient outcomes. So this is meant to open up discussion, so